it's very common that you find we are sharing a lot of social amenities, water, the washrooms, all this. But specifically where the water source is, you need to wash your hands first, and sometimes you also wash the knob of the tap, and then you fetch your water or you take the water. The same again, wash the knob of the tap, so that then you don't leave bacteria on the virus there, and then you close and still sanitize yourself to make sure that you do not pass any infection to that tap knob, or then you also don't pick it, which had been left there by someone else. Public transport may not be avoided in this country because it's the commonest mode of transport that we have. So it is the responsibility of each one of us to ensure that before you leave your house, you have sanitized yourself. Along the way to the matatu, you avoid touching as many services as possible. Don't do that. Then as you enter the matatu, sanitize yourself. Now when you enter the matatu, avoid touching as many services as you can. Just sit still. Then as you disengage from the matatu, please remember to sanitize yourself. Maybe your neighbor is coughing. Most likely you could be having a cell phone contact of this person. It's good you call the neighbor, them in that house, hey, are you okay? Because sometimes they could be coughing and they do not know, they could be very sick and they do not know who to call so that they can get to a testing point or to a healthcare facility. If it is possible to talk to them through any other means, that would be the most preferable one. If the situation is this serious, then the government of Kenya has already provided contacts, which then you can call. They will come and in appropriate gear for them to handle such a situation so that you do not expose yourself unnecessarily. We are being advised to self-quarantine and to limit a lot of movement. This is why the President of Kenya, His Excellency Uhuru Muigai Kenyatta, said that, if it is possible, work from home. This was to limit the movement. So you might end up saying that you move from Nairobi to upcountry and you carry along the disease with yourself. This has the potential to spread the disease even faster. So it is more prudent, as has now been confirmed, that we would rather maintain ourselves where we are, but most importantly, as we maintain ourselves where we are, is that we maintain good diet and good hygienic practices. And of course, when you are aware, then you seek medical advice. And it is also prudent that you can call your healthcare provider. You can call them and tell them, hey, I am feeling like 1, 2, 3, 4. Do I need to get worried? If there is a need for them to feel that you are at risk, they will invite you. If not that, they can give you consultation and possible directions on phone. This limits a lot of movement because we also do not want people to get to healthcare where there are other sick patients. Either transmit to them or they get infected when they didn't have.